Hello, my name is Jessica McGuire, and I will be covering the topic of obesity and eating disorders. Obesity is an abnormal accumulation of body fat, usually 20% or more over an individual's ideal weight. Usually, factors are considered like the person's height, gender, and age. More recently, guidelines for obesity use a measurement called BMI, or body mass index, which is the individual's weight multiplied by 703, then divided by twice the height in inches. A person with a BMI of 25.9 to 29 is considered to be overweight. A person with a BMI over 30 is considered to be obese. It was also interesting to learn that food intake is not only based on a person's eating behavior and internal factors, it is also affected by the information given from the body and the environment. Age is considered a factor because it makes a difference at what stage of life a person becomes obese. This can affect their ability to lose weight. There have been many concerns that have arose from the increasing incidence of obesity among Americans. Some studies have noted an increase from 12% to 18% occurring between 1991 and 1998. Other studies have actually estimated that a full 50% of all Americans are overweight. Obesity is associated with increased risk of illness, disability, and death. High blood pressure, type 2 diabetes, heart attack and other heart problems, hypertension, gallstones, infertility, and some forms of cancer like colon, prostate, and endometrial and breast cancer can be very concerning. After researching, I found that obesity is a side effect of other disorders, including hyperthyroidism. Among hyperthyroidism, it can also be a side effect of Cushing syndrome, neurologic disturbances, and consumption of drugs like steroids, antipsychotic medications, or antidepressants. There are a plethora of secondary conditions that can occur, like arthritis and other orthopedic problems, such as low back pain, hernias, heartburn, adult onset asthma, gum disease, high cholesterol levels, gallstones, high blood pressure, menstrual irregularities, decreasing fertility, and pregnancy complications. Shortness of breath that can be incapacitating, sleep apnea and sleeping disorders, skin disorders arising from the bacterial breakdown of sweat, folds of skin or from increasing friction between folds, emotional and social problems. Wow, I sound like a commercial now. Diagnosis of obesity is made by observation and by comparing the patient's weight to ideal weight charts. Doctors may also note how a person carries excess weight or his or her body. Treatment of obesity depends primarily on how overweight a person is and his or her overall health. It is recommended to lose weight if an individual is diagnosed with obesity, and the initial goal should be 5% to 10% weight loss over the first 6 months. This can be a difficult goal, but if the individual is able to stick to the meal plan and workout plan, they should be able to estimate long-term weight loss. Something to consider are what and how much a person eats, how a person responds to food, and how they spend their time daily. It is important to create a plan of how the individual will lose weight and create a healthier lifestyle for themselves to minimize the risk. For more obese individuals, this can be a large lifestyle change, but with the weight loss programs that emphasizes realistic goals, gradual progress, sensible eating, and exercise, this can be helpful. People with anorexia nervosa avoid food, severely restricted food, or eat very small quantities of only certain foods. Even when they are dangerously underweight, they may see themselves overweight. They may also weigh themselves repeatedly. There are two subtypes of anorexia nervosa, a restrictive subtype and a binge purge subtype. For a restrictive subtype, people with the restrictive subtype of anorexia nervosa place severe restrictions on the amount of type of food they consume. For binge purging, people with the binge purge subtype of anorexia nervosa also place severe restrictions on the amount of and type of food they consume. In addition, they may have binge eating and purging behaviors, such as vomiting, use of laxatives, etc. Anorexia can also be fatal. Some symptoms include extremely restricted eating, extremely thin in body mass, intense fear of gaining weight, or distorted body image. People with bulimia nervosa have recurrent episodes of eating unusually large amounts of food and feeling a lack of control over these episodes. This binge eating is followed by behaviors that compensate for the overeating, such as forced vomiting, excessive use of laxatives, fasting, excessive exercise, or a combination of all of these behaviors. Unlike those with anorexia nervosa, people with bulimia nervosa may maintain a normal weight or be overweight. Some of these symptoms include inflamed and sore throat, worn tooth enamel, sensitive and decaying teeth, acid reflux disorder, distress, electrolyte imbalance, and severe dehydration. Lastly, people with binge eating disorder lose control over their eating. Unlike bulimia nervosa, periods of binge eating are not followed by purging, excessive exercise, or fasting. As a result, people with binge eating disorder are often overweight or obese. Some of these symptoms also include eating unusually large amounts in about 2-hour span time, eating fast during purge episodes, eating even when they are full, eating secretly, feeling distressed, and frequently dieting. Once someone has to identify that they have an eating disorder, they want to treat it as soon as possible and try to catch it as soon as they can. They are at a higher risk of suicide and medical complications. Some people with eating disorders may also have other mental disorders, such as depression or anxiety or problems with substance abuse. Some ways to treat eating disorders include psychotherapy, medical care and monitoring, nutrition counseling, medications, or a combination of these approaches. People undergoing treatment should create goals like restoring adequate nutrition, bringing weight to a healthy level, reducing excessive exercise, and stop binge purging and binge eating behaviors. Complete recovery is possible. Research also suggests that medications may help treat some eating disorders and co-occurring anxiety or depression related to eating disorders. Hypothyroidism is defined as an increased thyroid hormone synthesis and secretion from the thyroid gland. This means that the thyroid is overactive and creates more thyroid hormones than is sufficient for the body. Excess thyroid hormones have some health problems like extreme weight loss, fatigue, tremors, and more. Furthermore, hypothyroidism can directly cause Graves' disease, multinodular goiter, Hashimoto's disease, autoimmune disease, ophthalmopathy, thyroid dermopathy, and acropathy. In the case of Graves' disease, generally you will get hypothyroidism due to Graves' disease rather than the other way around, and can be common with people who have an overactive thyroid. There are many different causes of disease that come from hypothyroidism, and that is where it would become treatable. You cannot treat hypothyroidism, only the disease that comes from it, but you can take some thyroid supplements to help. Graves' disease is defined as too many hormones generated by the thyroid gland. Metabolism is directly linked to the amount of hormones that circulate in the bloodstream. If, for some reason, the thyroid gland secretes an overabundance of these hormones, the body's metabolism goes into higher gear, producing the pounding heart rate, sweating, trembling, and weight loss typically experienced by hyperthyroid people. The most influential factors are heredity, age, sex, and frequency of stressful situations, even though the specific symptoms cannot be named for sure. Females aged 20 to 40 report of that issue more often than the rest of the population. You are likely to have exhaustion, overloaded feelings, annoyance, sweating, unhealthy heartbeat, pulse, extra sensitivity to the source of light, double vision, and more. It was a great opportunity to be able to research this topic, and I'm glad I was able to research more on obesity and eating disorders. I believe that people should be more aware of these disorders so that they can identify it for themselves if it comes up at any point in their life or a friend's. These are important topics to remain aware of at all times. I appreciate you taking the time to go over my presentation, and I hope that you enjoyed it.